Thank you everyone who has joined us for our Black representation in eating disorder treatment field. Specifically, we encompassed this event around Juneteenth, as that is tomorrow. And we wanted to specifically highlight that this isn't a day off, it is a day of service, it's a day on, as Derek Johnson of the NAACP states each year. So want to highlight that and why we're all here together. It's great to see Tasi, Reggie, Kelsey, and Dr. Tiffany all together and having this important conversation. Before we hop into it, I am going to discuss ANAD, EQIP, and Rock Recovery as they all came together to do this event and host it. So I'm going to highlight each organization specifically. So first, I want to start with ANAD. ANAD believes people heal better when they know they're not alone. Since 1976, ANAD has provided free peer support to anyone struggling with an eating disorder, whether you attend a virtual free support room, call the helpline, apply for a peer mentorship program. ANAD peer support volunteers will make sure you feel seen, welcome, heard in every interaction. In that, EQIP also partnered with ANAD to do this panel today. So EQIP is the leading eating disorder treatment on a mission to ensure that everyone who needs it has access to treatment that works. Built by clinical experts in the field and people who have been there, EQIP treatment leads to lasting recovery at home. We provide virtual evidence-based treatment through a dedicated care team, including a medical provider, therapist, dietitian, peer mentor, and family mentor, allowing each patient to achieve recovery without disrupting their life. We treat patients of all ages and diagnoses in 50 states. We accept most insurance plans at this time. And last, but definitely not least, is Rock Recovery. They were the final piece to our whole entire puzzle to do this presentation. So Rock Recovery is a nonprofit that supports the journey to freedom from disordered eating through holistic and accessible recovery programming and community empowerment. They do this by removing barriers of cost, location, and timing, and by helping people break isolation. They uniquely offer both clinical expertise rooted in research plus spirituality for deeper healing and restoration. They believe that complete freedom from disordered eating is possible, and their doors are always open, regardless of religion, race, nationality, gender, size, ethnic origin, or sexual identity, who wish to partake in their journey to freedom with everyone. So that is EQIP, ANAD, and Rock Recovery as we present this panel today. And of course, we have to discuss why we're here. So we're here to talk about eating disorder, Black representation, but also we're here to talk about Juneteenth. In that, we want to highlight specifically the NAACP's initiative this year. Each year, they typically hold an initiative, so then that way their advocacy is rooted in that. This year, their initiative is Black and Thriving. This is an ongoing conversation in our country. Typically, the conversation is how to be Black and survive in America versus how to be Black and thrive in this country. So that is what we're detailing this whole entire panel about, and is actually going to be deep-rooted in one of our first questions as we talk about that. Before I jump into all that fun and exciting stuff, I want to first toss it off to our panelists to intro themselves and talk a little bit about their work and why they're here. So I'm going to start off with Tasi, who is from Rock Recovery.
Hi, good morning, afternoon, wherever you are around here. My name is Natasia, but people typically call me Tasi, T, whatever feels right. I am with Rock Recovery here in Virginia, but we cover services in DC area, Maryland, and then we just recently extended to Florida residents too. And we just got in network with good insurance like Care First and Optum UHC, United Healthcare. One thing that I do with Rock Recovery is I'm one of the individual therapists, but I also offer group services like the meal support groups, the body image groups. I work with the teens. We have like a teen camp that's actually happening this summer. And I've been with Rock Recovery for a little under a year, but my work has extended past that, working in higher level of care with partial hospitalization and residential work with eating disorders. So I am just really excited to be here, talk about something that I'm very passionate about, especially because it wasn't talked about when I was younger. And I wish that was something that I had knowledge and awareness. So just happy to be here on this panel and hopefully, answer some questions for everybody.
Thank you, Tasi. And of course, we do have Kelsey Lloyd representing for Rock Recovery as well. Kelsey, would you like to come off mute and share a little bit about yourself and your work?
Sure. My name is Kelsey Lloyd. I work in private practice in the Washington, D.C. area. We often partner with Rock Recovery to help support their clients, and we collaborate very often. I have experience working with eating disorders, not only in outpatient, but also in inpatient, partial hospitalization, intensive outpatient. So I've seen the multiple levels, and I've just become more passionate about this work over time. And the hope that people receive equitable treatment, and that is one of my main drivers. And I'm really excited to be here today and keep talking about it and keep the conversation going.
And of course, I have to tap in my person who's from my organization, Reggie, from Equip Health. I'm going to tap you in, Reggie, if you want to share a little bit about yourself and our work.
Yeah. Good morning or afternoon to everyone, and maybe you're watching the recording, so maybe it's evening for you. My name is Reggie Ash. I use he, him pronouns. I am Director of Therapy at Equip. I have been here for just about a year and a half, but I've been in the field for 20 years, actually 21 years this year in July. And not all that time has been in eating disorders. Probably about 10 of those years have been in eating disorders, maybe a little more. After you get the decades in, it starts to run together a little bit. But nonetheless, I've appreciated kind of being in this field and being a Black man in this field and being able to talk about that. I unfortunately am a unicorn in that sense, but to be able to answer questions and provide some of that insight from that point of view, I get excited about panels like this. I was just saying it's also easy for me because I don't have to prepare anything. I just gotta show up and be able to be myself. That I can do. That's very easy for me to do. So I appreciate being here today. I'm also a talker, so I'm going to work on not talking as much so everybody has a chance to talk.
I think I can confidently say that we're all talkers, and that is a-okay. We should be if we're going to be on this panel, right? Let's talk it up. Last but definitely not least is Dr. Tiffany Resch-Wilson with ANAD. I'd love for you to come off mute and share a little bit about your work and also about you serving on the board with ANAD.
Yes, hi, everyone. Good afternoon, morning, evening, whenever you're watching this. My name is Tiffany Resch-Wilson. I'm a licensed counselor and a licensed psychologist, and I sit on the ANAD board. I've gotten to do a lot of really interesting eating disorder work over the last actually 25 years. So I've been a clinician. I'm still a clinician in private practice. I am a department chair for a graduate program at the Chicago School in Counseling, and I also am a team clinician for an NFL team. So I get to do a lot of different things, and eating disorders show up in each one of those areas. So since I was an intern in an eating disorder clinic many, many years ago during my doctoral program, I've gotten to see lots of really diverse clients with eating disorders, and I've gotten to see how eating disorders are not limited to any one particular group. There's no group that can be excluded from having an eating disorder. And one of the things that I share with clients and some of my students is that eating disorders are for people who have mouths. And that's probably the only common denominator. Anyone can have an eating disorder. And this work has been foundational to what I've been doing throughout the course of my career.
Gives me chills. I'm like so excited to be here. I feel like I'm in a room full of like having a moment right now. Grateful for all of you and being on this panel. And then, of course, I will be moderating. I will be very quiet and not talking as much in the corner, but my name is Makailah Dowell. I use she, her pronouns. I work as a lead peer mentor at Equip. I also volunteer with ANAD and also serve on their community engagement committee. In that, I also serve for AED, Academy of Eating Disorders, on their DEIB board. So I'm excited to be here, but I'm most excited to toss the mic off to all of you as we discuss this important topic. And to begin with, I do have an opening question. Please feel free for our audience members to go into the chat and put in questions as well. As we're going through, we will address the questions that are in the chat. So as mentioned previously, I talked a little bit about the NAACP and their initiative around Black and Thriving versus Black and Surviving, especially around Juneteenth as we discuss Freedom Day. How do you use Black and Thriving in your own work, and what does that look like? And this is open to all of you all, so whoever wants to come off mute first.
I'm happy to get us started. What this question reminds me of is a client who I've been working with lately who has an eating disorder, but also really struggles with dealing with colorism, and how it's been a really tragic experience for her. And one of the things we talked about just in our last session was how the things that this person does, that this client does, are based on their ability to do the best they can, and that a lot of the things that they do actually are working. And a lot of the things that they're doing, in spite of all of the racist, colorist things that they encounter, allows this person to still live a life that is relatively productive, with some things, of course, that we're working on. That's why we're working together. And this person is so entrenched and heavily self-defines as being a Black person. That's really important to them. And they've seen it in some ways as a deficit, but we look at it as a strength. So all of these things and all of these tools that this person uses to move through their day, that they look at as a defense, I'd ask her to look at it as more, if you're looking at it in terms of sports, as an offense. You are navigating the world, you're going through life, you're pushing forward and getting what you need. And that to me is evidence of this person being Black and thriving.
I love this question because there's so many different aspects or angles that you can think about with that question. For me, being in the field for over 2 decades, I haven't experienced seeing somebody Black in a director role or being in a lead role. And for me to do an interview with someone and introduce myself as, director of therapy, and knowing what that means behind that. Having clinicians that now work at Equip, like I got on the interview and it was a Black man's director of therapy. I told my mom there's a Black man's director of therapy. Like it's something that you don't see. And to be able to do that and show that it is thriving, it's not surviving. And I put my work in this field, and for us to show up and do that every day, I think that just goes a long way. And I like the transition of thriving, not surviving. But for me, that's how I kind of live that on a daily basis. It might sound arrogant, but sometimes just showing up is so huge, that I'm able to do that. Just to be present can go a long way sometimes, especially when you're underrepresented.
Yes, and if I may, I want to piggyback off of what Reggie said. Just like showing up is a sign of the way that we thrive. One thing that I do in my work with my clients is I like to look at the nervous system a lot, right? I use this all the time with my clients. When we look at the nervous system, it operates off of whatever is in our environment. If it's fear, if it's anxiety, it's whatever. And specifically for my clients of color, a lot of our conversations go into like, what's going on in your nervous system. It sounds like it's been in survival mode for a long time. And then, I validate the experiences, especially for my clients that are Black in America. I validate the experience of how your nervous system is always operating in this place of like, I don't know what's going to happen next. I don't know if I'm going to have access to this, all of those things. And so I validate the experience of how it is to be a person of color in this country, but also I remind them like, you're safe. Just remember, you're safe here. And you coming up to our sessions, you're safe and you're thriving. You don't have to be in survival mode anymore. We can be reminded, yes, like there are environmental factors that plays a big part in why we feel like we have to always be in survival mode, but just let you know you're showing up for yourself, you're showing up for your wellness, and nobody can tell us that there's going to be a failure to thrive here, because right now you coming to our sessions, you working on your everyday needs, meeting your needs is a way of thriving. So I definitely need to remind them of that.
Yeah, I think I have a lot of overlap with Tasi. I'm sorry if I didn't mention this before, but I'm a dietitian. So I think a lot of people come to me thinking about, like, what is this dietitian going to tell me about what I'm eating? And expect me to put a lot of pressure on their food or past judgment. So I think for me, it's really taking a step back and just letting them show up, and talk about food and talk about their relationship. And not making any comments or just realigning them and asking them those probing questions like, well, how does that serve you? Do you need to exercise if you eat X food, and trying to help break down those associations and really find their values, and take the pressure off food, because I think people think that's the only thing that health is related to. But to be Black in America, there are so many other things and so many other factors that are affecting our health, that food's not the end all be all. And I think giving people the space to take that pressure away is really one of my biggest ways to advocate for them.
Thank you all for those great answers. Something that like really stuck with me is what Reggie said was, there's some arrogance, right, in the way I show up. And I think in my head, well, it's not really arrogance, right? Because when we think about our counterparts, they don't really have to worry about showing up and surviving. They've always been thriving, right? So that's not really arrogance for them. So why is it arrogance for us, right? We still deserve that. That's what I think about when I think about our patient populations as well. All righty. So I wanted to ask this question. This one I'm really excited to ask because I'm curious from each of y'all. What brought you into the eating disorder field, and what has this experience entailed?
I can start out. How I got into eating disorders, I'm gonna be honest, I needed a job. I was working in crisis work in home, and my friend who was also a clinician, had connected me with Center for Discovery here in Virginia, one of the locations here. And I was like, I just need something new. I need a change. I'm tired of doing therapy in people's homes with the crisis work. And she was like, I remember the hiring manager told me, she was like, are you sure? I work with substance use and alcohol abuse and everything, and eating disorders are the scariest things. Are you sure you could handle it? And I was like, I don't know, but let me try it. And when I tell you, the moment I started working in this population, like I said, I started in higher level of care. I will attest that it was scary at first, but not scary in a way of like, I didn't think I could handle it. I didn't think that I didn't have the bandwidth to go about it, but I just recognized that, wow, I didn't even have the basic information about how to address eating disorders, because it was something that was so very new to me. Wasn't even talked about when I was younger. Wasn't even talked about when I was in college or grad school getting my master's in counseling. So I'm like, how am I expected to kind of get into this field with no knowledge, just the basic of like types of diagnosis? So what kept me in this field was just my desire to want to know more, and how much it really connected to my own self and my own growing up, and my experiences with my body. And I think coming into this field, I was like, man, I think I found my niche. It's always learning in this field. It's always connecting. And of course, like Kelsey said, it's more than just the food and things. It's really like, wow, a lot of us have a lot of shared experiences, especially people of color, when it comes to food and body. And so I think I became passionate of wanting to break down a lot of those narratives that we grew up with, and that's been like, pounded in our head for many years. So I really love working with this population. Again, like I said, I didn't have anything astounding that got me here. It was just like I needed work and something new, but then the work that I do here has kept me here and very passionate.
I don't mind going next. The thing that brought me into the overall mental health field, quite honestly, and I'm slightly amused by it now, is Lucy from Charlie Brown was a psychiatrist who charged 5 cents for her therapy services. And I, from that point as a small child, thought I want to do whatever that is that she's doing, even though she wasn't my favorite character. The eating piece, the body image piece actually started for me in 4th grade at a book fair when I bought my first diet book, because there were kids in the class who would tease girls who had big butts. And then as you got a little bit older, there was like bra snapping, popping bra straps and that kind of stuff. So I was very hyper aware of body. And then by high school, knew a couple of people of color, mostly Black girls, but a couple of people of other races in this relatively diverse high school who had problem eating, and people didn't see it. And they saw it because it didn't fit the image of what an eating disorder client or person looked like. And that was problematic to me. Then undergrad in college, I read a study about, specifically what I just stated. Somebody divided up a college classroom into 3 groups, gave them a case study and said, this one's about a Black girl, this one's a white girl, this one's a Latina girl. Everything else was the same. What is the diagnosis? The diagnosis should have been anorexia nervosa, but they got substance use for one, poverty for the other one, and eating disorders for the white girls. So even when something is right in your face, sometimes people choose not to see it, in part because maybe they're not exposed to it, in part maybe because it just doesn't fit the narrative, because eating disorders still enjoy, and I say that completely facetiously, this idea that they are this elite, elusive category of disorders, that they're not. They're still a diagnosis. It's still an illness. So that piece brought me in and kept me there. And then the thing that solidified it is I was at a family event once, and when I was writing my dissertation, one of my relatives said, what are you writing your dissertation on? And I said, eating disorders in African American women specifically. And she said, all you're going to find out is that Black women don't do that. When she walked away, her sister tapped me and said, wow, she is my sister. I'm my best friend. And she didn't know that I've had an eating disorder most of my life. So even in plain sight, this person didn't see it. And that piece lets me know that there is a need for people who can understand and see you when you have a disorder. That's what brought me here. That's what keeps me here.
I feel like I have a combo of both examples for how I got here. I am not one that got into the mental health field specifically for eating disorders. And I don't even have the examples to reflect on like Dr. Tiffany just did, because it wasn't talked about. And I didn't even recognize it until I start working with eating disorders. Even in school, I think the eating disorder section of my master's program was like a brief thing, and then we were on to the next thing. And it wasn't until I started working with eating disorders and I'm like, oh wow, how many people did I misdiagnose? Oh wow, how many people in my family? Oh wow, how many people in my school? Like then it became like clear to me. But I was one that eating disorders found me. I was working at a different place, and I went to a conference, and a colleague that we graduated with, or actually I think I graduated right before her, had an opening on their eating disorder team. And I'm like, I don't know anything about eating disorders, but it's got to be better than what I'm doing, right? So let me go ahead and do this. And it was just fascinating to me. The body image piece was just like intriguing to me, and it wasn't psychosis. And I was just so intrigued by that it just sucked me in. And I was a clinician on the team for about a year, and then after that year, I became the director of the program. So that just even expanded my growth as far as like, now how do I train people? How do I help others? How do we build this? How do we expand? So we went from an outpatient to a PHP and an IOP, as well as a outpatient. So just that, then I had my growth professionally. Then I wasn't doing that type of stuff beforehand. So eating disorders has really helped me thrive just professionally and what I've been doing. But that was my introduction to it. Eating disorders found me, and I have a passion for it now.
Yeah, for myself, I've always loved food. I always loved biology, so that kind of like shepherded me into studying nutrition. And the nutrition field itself, I think, eating disorders is this tiny corner off to the side. And so I didn't get a lot of experience with it, but one thing I knew coming out of my dietetic internship in grad school is that I had an interest in sports. I still have an interest in sports. And I knew in the back of my mind that, eating disorders, were more frequently diagnosed in athletes. So I told myself, oh, I'll have to learn about it one day. But I think the real turning point for me was during the pandemic. I saw a post on social media from a Health at Every Size dietitian, because I don't know if you remember, but during that time, people were worried about weight gain during COVID. And I saw a post that said, you know, if the worst thing that happens to you in a global pandemic is that you gain weight, then you don't have that much to worry about. And I think that really changed my perspective, in that we're going through a crisis and people are worried about weight gain and what they look like while they're stuck in their houses. And so as soon as I found a clinical eating disorder dietitian position open up close to where I was located, I applied for it. And that's what I've been doing ever since. And once I got in, I was like, I don't know if I want to go back to sports full time, or if I'll ever give up this eating disorder part, because it's just so fascinating. And when you kind of zoom out, there's so many components. There's, you know, a social justice aspect to it. And it's so prevalent, and we don't even notice it. And kind of in reflecting in my own experiences, thinking about the community I grew up in, and like being surrounded by women who I admired and I loved, but were always so hard on themselves about their bodies. And I was like, if I can help people not do that or stray away from that mentality, then I think I've served part of my purpose. Because it's just it's so prevalent and it's everywhere, and we don't even realize it.
I've served part of my purpose. I'm gonna take that home with me, Kelsey. I really, really like that. I really love that language. Dr. Tiffany Rush Wilson, we gotta talk about Lucy. What, like, that's who inspired you? Like, how, that is one of the best stories I've heard.
She had a private practice too, self-pay. Lucy had it going on, sort of. She just wasn't very kind, but yeah, that was my original inspiration.
We'll work on the kindness later. I think the 5 cent thing is more accessible, right? I'm appreciating the 5 cent support. So, all righty. I'm gonna tie these two together, because I feel like whoever wants to talk about each piece, feel free. But A, what are barriers to BIPoC education in the eating disorder field? That's one piece of it. And then what are the current barriers to care for BIPoC patients that you see? So a 2-in-1, right? What are the barriers to even becoming a clinician and being in this field? And then what does it take to even treat the populations you're looking to serve your purpose with, as Kelsey said?
What education is what I say. Sorry, Reggie, go ahead.
No, it's all good. I was going to take the education part of that question. And this, you know, you're on a panel because it's part of my experience. So I don't know everyone's experience. Someone told me, some of the great advice that I had was, she said to me, she said, don't pay for grad school. Now, I didn't know what that meant. I was fortunate enough to have a football scholarship and all that type of stuff. And I thought, all right, I'll just be paying for grad school. When she said that, I looked into it and understood then what an assistantship was. So go get assistantships. Assistantships help you pay for your school. I have no debt for my master's program. I believe that our people want to avoid debt, and they don't think about that next level of education. So, you know, to get a counseling degree, you have to have a master's degree, but it does not have to cost you anything. These schools and universities have assistantships. My particular assistantship came from the African and African American Studies. They don't, you know, they have them for different programs. And again, that was 20 years ago, so I don't know all the ins and outs of what it looks like now, but I know they still have assistantships. And it's ability for you to get your school paid for, get a stipend to be able to live comfortably. Well, I also went straight through after college, so I don't know what that looks like for someone that might have, you know, a family. I don't know if that still works, but nonetheless, it's still money that's available to avoid that debt. I think so many times we get in our own way sometimes with that piece. And just to know that we do have opportunities out there for assistantships, and it's just about asking. I was doing my interviews for my master's program. No one said anything about it. No one talked about it. I asked about it. So once I asked about it, linked me with the right people that I need to link with, and basically had a full ride for our master's program. So I don't know if it works that easy for everyone, and I don't know that it was an easy process for me so many years ago. I just remember finding at the last minute a school. I said, "Oh, I'm not gonna be able to come. You can give me assistantship," and they found a way and got the assistantship. So it's there. Take advantage of that to be able to go to school and not let kind of that debt kind of get in our way.
I'll say from my perspective, because my training was in dietetics, so mental health wasn't even really a part of the picture. It may have been like one lecture where they, tell you how to refer to other people. But I think dietetics as a whole isn't super accessible, mainly because we have to go through an internship that's unpaid. For some people, that's up to a year. My internship was about 7 months long. They oftentimes require you to not work during that time so you can focus on your internship. And thankfully, my family and I were able to figure it out, but it's still like that's still, education I'm paying back on right now. So a lot of people don't even pursue that track. Oftentimes I think Black folks or other folks of color will, go to the medicine route because that the payoff is there in the end. So even getting there from a dietetics perspective is really difficult. And then I think once you're in this position, you want the high paying job to make up for that. And in the mental health field, I think things are getting better, but it's not always, reflective of the work and the experience that you've put in to get there. So I'd say that's one of the bigger barriers from my perspective, coming from more of a dietetics position. But I do think people are building more awareness, and there probably are more clever ways to go about it than I am. I know that the dietetic match, so essentially the way that people match for med school, where you get one program and that's it. I think they're dissolving that. But when I was still in school, like I got matched. If I didn't accept my match, then I'd have to wait a whole nother year to get matched again. And it's a 50% match rate. So you don't really have the options of choosing the most financially sound idea. You just get that one shot, essentially.
It's interesting. One of the things that I think might be a barrier to BIPoC education is the representation. When you look through, at least in mental health, a theories book or some of the examples and case studies that you get, those people may have very clear, valid problems that might be very different than how they would present for you, whoever you happen to be. And it was really interesting to look through theories books and read about these various clinicians who started things where I knew that this person may have had a foundation or even a pretty good hand in how this theory was created. But sometimes there's a person underneath that person. There's a foundation that's not represented in a theories textbook that might involve somebody who looks more like me or looks more like some of the other people in the world, not just these fathers of mental health. Another deterrent, I think, comes from another example I have from working with, thank goodness, not at the place where I currently work, but at a different university where I did have a couple of run-ins with faculty members who said some really condescending and flat out racist, sexist, even transphobic things about people who were represented in our student body, who were represented on our faculty, because they could, and they felt entitled to make these types of comments. And when students, when colleagues, when faculty members, when clients encounter someone where you can kind of experience that palpable energy of aloofness and disregard for someone, it's a deterrent to want to enter and share space with them. So I think sometimes it's the human beings involved that can be both a deterrent and hopefully a draw, given who we are on this panel, into mental health.
And if I could just add, as mentioned earlier, I think even Reggie has said it, that the information about eating disorders in general is not really accessible, or not accessible, but it's not, readily there in school. Like I could think about when I was in grad school like 4 years ago. I don't even remember if we even talked about eating disorders. It might have popped up in my diagnosis class, but if you look at the prerequisites for what was required to graduate, you need like the ethics, substance and, alcohol abuse class, you need med management, those type of classes in order to graduate. But I don't even think I had other classes I could take to learn about eating disorders. So I think the barrier is just like, what are your campuses even providing? Like, is there even information? Are there classes? Are there workshops? And if you don't know what's readily available to you, you don't know what to look for. You don't know what to learn and, get more information about, especially if your university isn't even offering that type of information. So, and I went to a predominantly white institute. So imagine like on HBCUs and things like that, and smaller campuses, like are these conversations even happening? So I think that's like a big barrier, is not even knowing if that information is readily available to you. And I think what helped me to kind of get any common knowledge was just working in the field. But I do know a lot of these organizations, and like my practice, we do offer internships. So if you are interested in eating disorders, go to like, the bigger organizations or smaller practices in your area and see like, hey, are you offering internships? Are you offering, opportunity for me to volunteer? So I could just get some more information about eating disorders, so I could sit and learn, and how we discuss it in this environment. Sometimes they hold smaller workshops in the community. And that's just information that's just how I've gained more information since being in the field. It's just like, oh, networking events. That's how I've got more, since being in here. So while you're still in school, assuming that most of you here are still in school, definitely reach out to those smaller places or those bigger organizations that offer eating disorder help, and see what, kind of volunteer or internship opportunities they have for you. Some of them are paid too. Some of them are paid.
I'd like to piggyback off of what you said. One of the things that was really important for my learning in this field was going to an Eating Disorders Awareness Week presentation when I was in my master's program. And there was a physician there who was talking about the Academy for Eating Disorders. And I stayed afterwards, talked to her, and she said, if you come, you can be my guest. And there were some ways that they were able to get the fee waived. And it was one of the most amazing experiences for me. And I was going every year, got to serve as chair of the transcultural SIG for a couple of years, just to absorb the information about eating disorders in general, and then within special populations. I think that conference is an amazing one. And some of the journals related to eating disorders, International Journal of Eating Disorders, the Treatment and Prevention Journal, lots of those. A couple of the other organizations that are related to eating disorders, like IADEP, those are really great places to jump in and get your feet wet, figure out what's going on, what opportunities there are, what conferences there are, and then connect with the people at the conference. So for me, it was like going to like the Grammys, because like I'm seeing this person there and they wrote this article that I read, and to see this person there and they authored this book. And that part was really helpful in getting into the actual field, because there was limited information in classes. I had to create my opportunities to learn more about eating disorders by manipulating papers. So if we have to write a paper about ethics of working with children with this particular diagnosis, my diagnosis was always an eating disorder. I found ways to create a path for myself, but there are also organizations, professional organizations, that can help you get your foot in the door.
Makailah, I might be jumping the gun, and I'm sorry, but there is a conference for BIPoC, for the BIPoC community in July 17th through 19th, and I believe it's a discounted price for students who want to register for that. I bet you're gonna already talk about that, but I just wanted to make sure because Dr. Rush Wilson said something, and I was like, ooh, let's go ahead and share that now.
No, Tasi, you can always cut ahead of me to share a great BIPoC resource. What are you doing? Absolutely. Of course, BIPoC ED conference. If you haven't checked it out yet, we can provide it in the link of the follow-up in the email. You will notice that Equip will be there doing a fabulous panel, and then we will also have a Q&A around breaking down barriers. But yes, that's a great highlight. And that's what that reminded me of, Dr. Tiffany Rush and Tasi, was, you know, how I kind of, I came into the field 2 years ago, and I was like, how do you meet people? Like, how do you connect with people that are in your communities, and what does this look like? And I ended up going to my first media conference, and I had a very starstruck moment. I was like, oh, this is like the Grammy. Like, I was trying to get selfies with people. I was having a great time because, you know, it was a very much like a Grammy moment. So thank you for highlighting that and the importance of why we go out and we connect and we do these events. Even getting to meet you now, and Tasi and Kelsey and Reggie. I don't have to meet you because I get to see you a lot, but you know, it's the importance of this work. So I really appreciate that and highlighting that. I actually had a question that tied into this and kind of piggybacked a little bit. Kind of going back to any more resources, if you want to share, Tasi, great call out for the BIPoC ED conference. And I wanted to ask, you all touched on a little bit, but I want to explicitly call it out. What is the state of representation of BIPoC providers in the eating disorder field? What are you all seeing? What does it look like?
Stats about people of color in the mental health fields roughly show that about 9% or so, just broadly, of eating disorder, or of clinicians in mental health identify as a racial minority. That's not very many. And then when we, sometimes look at sexual minorities, we never really cross that 50% mark when you start to intersect all of these identities. So what I've seen in eating disorder field specifically is sometimes I'll walk into the room and I'm the only person of color. Sometimes I walk into the room and there might be maybe 2 or 3 people if it's a larger group, but there's not a lot of representation professionally. And one of the colleagues I have, and I actually have had several conversations about this, and how do you bring attention to it? What kind of awareness needs to be raised? And how receptive will audiences be, other professionals, when it's brought up? Because I certainly have heard days and times where people would say, well, it's really not that important as long as you receive good care. But I do believe it is important.
Yeah, before coming to Equip, I worked at a hospital, and so I think there are up to like 15,000 employees. And that's not all behavioral health, but um, I can count on maybe 2 hands how many clinicians of color that I saw. But then that number did grow as I was there. I was at the hospital for 10 years, so it did grow. But then to give some more context and break it down into like eating disorders. So I was at a hospital and I had the eating disorders program. But give some context as far as representation with eating disorders. Here at Equip was my first time that I was in a room. Now, Equip is a virtual company. So when I say in the room, I mean a Zoom meeting with not one, but 2 other Black male therapists. That was my first time in 20 years in this field that I've been in a room with 3 Black men that were clinicians in 20 years. So that's just the context of it, of how sparse there is representation. And I think Dr. Tiffany Rush said that earlier, of like just representation. That's a huge thing. And I didn't know those numbers, but 9% is extremely low. So yeah, I do agree that it's sparse in eating disorders.
And I want to make sure I correct myself. I looked at the numbers while you were speaking. For psychologists, it's just 4%, 2% of psychiatrists, 22% of social workers, 7% of marriage and family therapists, and 11% of counselors. So it's really low.
Yeah.
I just want to say that Reggie is the first Black male therapist that I've ever met who has specializes in eating disorders. I haven't met any other yet. I hope to see more, but he's the one and only, like you said, unicorn. I'm amazed. I'm like, whoa, because I don't see it. But I'll tell you, before I even started in eating disorders, the most Black representation I've seen in mental health was because, like I said before, when I first started my career, it was in residential care and also crisis care and in-home care. and a larger of the population who worked as mental health clinicians were Black and brown people, because we were doing a lot of the, how do you say, challenging work on the field, working with at-risk youth, families, family work, you know, going into their homes. And there wasn't a lot of, how do I say, white clinicians doing that work. They were doing more of the managerial stuff, but we were a lot of the ones who were doing the things on foot. However, when I started, you know, going into different sectors like, you know, higher levels of care, where care is a little bit more, how do I say, not as affordable and a little bit more expensive, I started to see less and less of people of color, specifically Black clinicians, working in these spaces. When I was working at high level of care, it was only 3 of us out of, I think, 30 something people that worked in that office that were Black. And of the clients, I went from working in a population of mostly Black and brown people to now I'm in higher level of care, and I only had like maybe 1 or 2 Black clients in higher level of care, specifically in eating disorders. And now that I'm an outpatient, I'm the only one, basically, where the only Black clinician working in outpatient specifically for eating disorders. So what I'm here to say is that as you look at different sectors of care, you'll start to see like less and less of us in these areas, and especially in specialized care like eating disorders, because again, accessibility for clinicians, they don't really, you know, I think education already is not like easily, you know, accessible and ready for you. But then also when we're talking about clients, it's really not affordable when we're talking about specialized care for eating disorders. It's not easily accessible. Some of these places don't even take, you know, a lot of them don't take Medicare, Medicaid, or anything like that. Lucky if you could take insurance, especially, I'm sure Kelsey can attest, like, you know, in the dietary field, rarely any type of insurance. So as the levels of care change and the type of care, you'll see less and less of us being represented in those areas, unfortunately.
Yeah, I don't have a whole lot to add. I think the statistics for dietitians as a whole, it's something around like 3% of us are Black. And then I'm not sure how many of those folks specialize in eating disorders specifically, but it definitely doesn't feel like enough. I do think a lot of the times we're maybe on the forefront of, you know, pushing against diet culture, which does overlap with eating disorders, but it is still its own specialized field. And so I think you have a lot of clinicians who are sensitive to it, but might not know the in and outs of eating disorder care. But I agree with everything else everyone shared. I think it depends on where you're at. I think in some areas it's getting better, in some areas it's kind of staying stagnant.
I could just keep this panel. I'm like checking time. I'm like, I could keep this panel going on personally forever. You know, we could just hang out, maybe get a coffee, just chat, you know. Yeah, I just appreciate you all sharing those insights, especially on that topic, because we do have to address it, right, in order to embody or take any type of change on it. Alrighty, I want to be cautious and mindful of time, so I have a couple more questions for you all. But I wanted to highlight this question and then I'll go to the final question. Can you share a time when representation in a patient's treatment really mattered and was important?
I can share a small story. When working in a partial hospitalization program, there was a client who was not my client specifically, but you know, they shared with their team that they were going to walk into the treatment center and expect like every single person to be white. But when they saw that there was, you know, a Black therapist on staff, there was a Black dietitian on staff, there's support staff who was Black, they immediately felt a sense of relief, because coming in, they weren't even sure they were going to do the entire program. But even just having the reassurance of, you know, seeing some people around who, you know, they know are contributing to the conversations, who are giving some input, I think help them kind of relax a little bit. And And even if their entire team wasn't Black, they still felt reassured that, you know, someone can have my back if it comes down to it. And so I think that's probably one of the more recent examples I can think of, but just in discussing with the team, knowing that they initially weren't so sure, but just having that like recognition, they were able to kind of let their guard down and stay a little bit longer.
An
Along those
example
same,
is,
oh, go right
go ahead.
ahead.
No, go ahead.
Just briefly going to reinforce that right from my experience along those same lines. I've had people who look at the picture on Psychology Today and say that they selected me as a clinician because they thought that I would get them perhaps in a way that someone else might not. Sorry, I didn't mean to cut you off.
No, you're good. I was gonna say an example like that. Me walking in the lobby, I mean, people of color would stop me, like, can you be my kid's therapist? And that piece. A specific example I have. So I think my official title was clinical coordinator at the Children's Hospital I was working at. And this isn't a direct patient care because this wasn't my patient, but there were a lot of white faces that helped kind of build that program, and I had to represent. And we had a chef, and we did the meals for people that were in PHP, and yeah, some of the food that they created, I just didn't think was the best menu items for people. But nonetheless, we had quinoa on the menu, and we had an African American 13-year-old female refuse to eat. So you know, she's getting the boost and that whole process. And I actually went in and talked with her because she had been doing so well. And it wasn't about the eating disorder. It was about, what the hell is quinoa? I don't want to eat this. I don't even know what it is. I mean, these menu items weren't these like typical menu items. And it's like, what is this thing? I don't want to eat it, not because I'm refusing to eat. It's because it's quinoa, and I don't even know what this is. I've never heard of it. So it was like, in that moment, to go to the team and say, this is an example of what I was referring to. Of now, here we are, this person's, you know, getting insured and all that type of stuff, when they've been successful. And it was just about kind of menu items. We really need to think about that, for all cultures. We have to look at all cultures when we're talking about food. We're impacted by all cultures when it comes to food. Everyone sits and eats together in some form or fashion. So how can we be more culturally effective in doing this? So that was a specific kind of like eating disorder, like representation at that time, how that can impact a family.
That story always sticks with me when you share it, because it's a story I always go back to when I think about traditional treatment centers and like why we consider social determinants of health, why we consider cultural competency of care, because that's an example of like, it's not that treatment wasn't working for them, it's that treatment was failing them, right? It's such a great example. Alrighty, I want to be mindful of time, so we are on our last question. So I want to make sure everyone can answer this final question we have. Is, do you have any words of wisdom you want to share with the group? What makes this worth it?
All right, I'll take a stab at this one. And maybe it's wise. I don't know. It's a great question. I will say, to continue pressing on. I know that might be very typical, but in this field, again, assuming a lot of you are students, there's going to be moments where maybe you do feel kind of alone or kind of in a box, kind of on an island. Reach out, make those connections. It becomes important to have, you know, someone else there to bounce things off of. Maybe it's a clinician, maybe it's not a clinician, but having support just becomes huge. I know there's just going to be ups and downs. There's just ups and downs in life in general. Anyway, life happens to everyone in every moment. So just to have those connections and being able to to speak up. I think in my experience, I didn't speak up enough. I've had certain things happen that I didn't even recognize were happening and didn't recognize the racism behind it, didn't recognize the microaggressions. And you look back and reflect about it afterwards. And I wish I could sit and say that's not going to happen to anyone. That's probably not true. But also giving yourself grace. Like I said, I look back like, oh my God, what was I thinking? What was going, and it's just like, it happened already and I missed it. But nonetheless, don't get down on yourselves and give yourself grace and, have those connections, go to those events, connect with people, cell phones. I think now you can just tap your cell phone and get somebody's number. It's not hard. It's not an effort. I had to write things down and find a piece of paper back in my day to actually write down stuff. So make those connections and best make a difference.
I would like to say is, of course, to piggyback off of what Reggie said, just like that advocacy piece is very important. And while advocating for yourself and hopefully for your future clients and just, knowing what to ask and start practicing now as you go to the doctor, as you go through your own things with body image, going to the store to go shopping for things, check your own biases about, diet culture that you might have about body and about health. One thing that I'm really big on is knowing that I could be in a larger body and a fat body and still be very healthy. And so work on your biases, on dismantling that narrative that, you could only be this type of body in order to get to be healthy, or be in this type of body in order to be considered acceptable or lovable or ideal or anything like that. So definitely check your own biases. When you go to the doctor, practice that too. The doctor's going to assume like, oh, because of your body, your size, that must be why you have high blood pressure. Let's not do that. Let's check some other things, because I could just be stressed. My body, my weight may not have anything to do with that. So as you're working on, getting into this field, if that's something that you're interested in, start checking your own biases, start advocating for yourself in these spaces, so that when you do become a clinician or a dietitian or anything that's within this field, you already know how to relate with your clients and help break down those narratives that they keep fighting daily, about their body, about food, their relationship with food, about how culture is related with food and body and things like that. Because our work here is just dismantling that all the time with our clients. So practice that for yourself first, so that when you come into this place, you already got it.
I really appreciate you saying that, Tasi. I think that was really well put, because you don't want to carry those things into your work. And we're all subject to it. It's not, it's been ingrained in us since we were kids. But I was going to say, this is something I'm myself probably still working on, but I think, a lot of us work to the point of excellence all the time. And in the mental health field, it's so easy to run yourself into the ground. So going into your work, kind of thinking like, I know this is a hot word, but like, what are my boundaries? Like, what can and can't I do right now? Because you have to pour into yourself to show up for your clients. It'll be so easy to burn out if you're not taking care of yourself in tandem with this work. So making sure you're holding space for yourself at the same time. It's so easy as like a new grad or a student to like hit the ground running, which is great, but make sure you're still making time for yourself and pouring into yourself too.
I think it's also important to make sure you take advantage of the resources that are available to you when you're working, because Kelsey, as I'm thinking about what you do, one of the biggest collaborators I had, especially early in my career and even now, was a particular dietitian who just knew her stuff and was able to really help me with the clients I'm working with. And she was the bad guy because she was the one with the scale, but she was the person who was really instrumental in making sure that we could help our clients outpatient as long as we could. And sometimes they had to be referred inpatient, largely based on what she was able to tell us. So having that treatment team with different mental health providers, the dietitian, nutritionist, the physicians, all of the people involved, the psychiatrist is really, really helpful. And once you work in this space with people with these particular diagnoses, it's really important not to work in isolation. and to use what you can to help treat your client and also to help keep yourself in a space where you don't feel so frazzled and siloed. So thank you
What
for being a
what a
dietitian.
great way to end. What a great way to end. Yeah, and thank you, Kelsey. Yeah, it's interesting. You all kind of like touched on this idea of community in our spaces, and this is why we do this work. This is why we like combine as organizations. Rock Recovery, ANAD, and Equip is like this is a together aspect. And it reminds me of one of the lines that Derek Johnson says is like, when you win, we all win, right? So it's a collective and it's definitely it's a working group for us all. I am so grateful to ANAD, Equip, and Rock Recovery, and of course, Tasi, Kelsey, Reggie, and Dr. Tiffany Rush-Wilson. Grateful for you all for coming. This recording will be out after we close out, so you all will have access to it. And then we'll also be sending out a following email with resources, specifically from the NAACP, specifically from BIPoC ED, as Tasi mentioned. And then we'll have a couple resources from our partnering organizations for this call. Again, I want to say thank you. I don't think my gratitude is going to be able to show as much right now. So tomorrow, I hope you all can take the day and show up in that way of advocacy of service as a day on. And of course, if you have any questions, reach out to ANAD, Equip, and Rock Recovery. Thank you all.